Esse CRTV Buea.
Hello, good morning and welcome to Health Update over CRTV Southwest in Buea. We shall be talking about epilepsy in this edition of the program. Sophie Joseph is on the panel mixer, Lydia Ndolo is on the books, and I am Tiki Julius. Our greetings to our friends of Radio Bonakanda who are relaying this program. Our guest is Dr. Cyrille Nkouanlack, a neurologist at the Buea Regional Hospital. Doctor, glad to have you.
Thank you. Good morning, Mr. Teki.
We're going to be together for the next, say, 58 minutes or so, but then we're going to run the program for about 25 minutes to allow our resource person give you ample information on epilepsy before we start receiving our calls. Remember that the number is 233-322525, 233-322525, and that will be in just about 25 minutes time from now. Welcome back. Like I did indicate, our guest is Dr. Cyrille Nkouanlack of the Buea Regional Hospital, and is here this morning to talk about epilepsy. Doctor, what is epilepsy?
Thank you, Mr. Teke. So we're talking about epilepsy. So epilepsy is one of the most common diseases of the brain. It's a disease which is characterized by recurrent fits, or what we also call seizures.
Mm-hmm. What causes these seizures? What is in the epilepsy that will lead to seizures, that will lead to convulsion?
So the seizures, in fact, are due to brief disturbances in the electrical functioning of the brain, and those disturbances will be characterized now physically by the fits. And there are different types of fits. They could be generalized, that is involving all the body, or just part of the body could be involved. So that's the basic characteristics of fits or seizures or convulsions. They all mean the same thing. Now, their causes are many, because usually people think that it is something which is witchcraft or contagious. No, one of the main information we are passing is that epilepsy is not witchcraft. It is not something which is contagious, but there are specific causes which are known for epilepsy. One of the most common causes of epilepsy, especially in Africa, sub-Saharan Africa, including Cameroon, are infections that involve the central nervous system. So these infections will lead to lesions or to problems in the brain that will now disturb the electrical functioning of the brain and will now lead to fits. Apart from infections, we also have head injuries. When there is a trauma involving the head, there may be a scar at the level of the brain that will also disturb the electrical functioning of the brain and can lead to fits. We also have other causes that come from birth. For example, before birth or during birth, if there are infections or if there are injuries during birth, we can have trauma to the brain, which later on will lead to the child developing fits. And there are several causes. Now, some of the causes are just genetic. That is, the person is born with inborn deficiencies or inborn problems that predispose them to have fits. In that case, they are either cryptogenic or the cause is not very clear. But then it is known that there are some genetic causes that can lead to epilepsy. But in Africa and in Cameroon precisely, most of the causes, they are due to infections of the nervous system. And these infections have been characterized, especially we have tapeworm. Tapeworm, the larval form of tapeworm, when it gets to the brain, it will lead to a type of disease called neurocysticercosis, which can lead to epilepsy. And that is very common in the region of the West region and the Fontem region. And then we also have onchocerca and other parasitic infections that, when they involve the brain, can lead to fits or epilepsy, which is common in the Mbam region and the Batibo region, where we have areas of high prevalence of epilepsy in Cameroon.
Some of the areas you just cited, like Lebialem and parts of the West region, are areas noted for high consumption of pig. Mm-hmm. Could that be a reason for that?
Yeah, in fact, it could be a reason, because if the pork meat is not well prepared, the larval forms will not be killed during the cooking, and in that case, they will continue their life cycle in the human system, and when they get localized at the level of the brain, they may lead to convulsions later on.
What did you say the causes for other localities like Batibo and the Central region?
In the Central region, there are mostly parasitic infections. Mm-hmm. And then there are still questions whether onchocerca volvulus or river blindness, when it gets localized at the level of the brain, can lead to epilepsy. And then we also have other infections. It's not only these parasitic infections. If somebody has meningitis, after the meningitis, if it is poorly treated, they are prone to develop epilepsy later on, because there are scars that develop in the brain. Or if you have severe malaria, if it is not well treated, after the malaria, you may develop mental retardation and other conditions in the brain that can lead to epilepsy later on.
Earlier on, you talk about electrical functioning of the brain. What is this all about?
For us to talk, to move, to carry out all our functions, the brain is like the central command for everything. So for the brain to do that, there are basic activities that take place in the brain, basically electrical conduction. And it's this conduction that will lead to development of or will trigger, will command the other parts of the body to function. So when there is that disturbance in the electrical functioning, there is excessive functioning of certain parts of the brain or the entire brain, and that excessive electrical functioning or disturbance will now lead to the excessive movements that you will observe the person with epilepsy having. So it now depends on if it is a focal point of the brain that is involved, or it is the entire brain. And that will lead us to the two main forms of epilepsy that are known. Either it is a generalized, in which case all the body is having the fits, or it is focalized, or it is a partial form where only part of the body is having the fits. And those are just the two main forms, because the brain has several functions. We have forms of fits where the person may just be absent. That is, the patient does not talk, just stares at you without having any movement. We have forms of fits where it can manifest just by behavioral abnormalities. If it is the area of the brain that is concerned with behavior is concerned, or is disturbed with electrical functioning, then the manifestation will be that. So it all depends on which area of the brain is involved with a problem, and then the fits now is characterized by the manifestation of the normal functioning of that part of the body. But the two main types are generalized and focal seizures, or focal fits.
Doctor, there are many people out there who strongly believe that epilepsy is caused by witchcraft, and many of these people have a school of thought which says that it is not normal that somebody is born with that epilepsy, and somewhere along the line at the age of 21, 30, epilepsy suddenly crops up.
I think that's one of the main reasons why we are here online, because we have said there are known causes, and it is well known that it is due to electrical disturbances in the brain. Now, the idea that it is caused by witchcraft is because when something is mysterious or when something is not understood by the layperson, they usually first coin it to witchcraft before they try to understand. But it is well known and it is well described that there are causes, specific causes for epilepsy, which can be treated and which can be prevented. For example, we talked about infections of the brain. If those infections are well prevented, we'll have less cases of epilepsy. Or if we control the number of strokes, because after a stroke, there is a scar in the brain, and the person can also develop focal seizures with respect to which area of the brain that was involved. So there are specific causes for epilepsy, and epilepsy is not witchcraft. Epilepsy also is not contagious, because apart from believing that it is due to witchcraft, people also think that it is contagious. For example, if I touch somebody who is having epilepsy, who is suffering from epilepsy, I will be contaminated, which is not the case. Or if I touch the sputum of somebody who is suffering from fits, who is having fits, I will be contaminated. Those are all misconceptions that people have or people think about epilepsy.
What are the manifestations of epilepsy in a way that is understood by common people out there in our communities who live with children, who live with adults, and see somebody having what we are explaining?
Now, the attitude, the general attitude is not to panic, because usually there is a lot of panic when somebody is having a fit. The first is not to panic, and then to, first of all, try to put the person in a comfortable position. If you know that it is not contagious, you will not be afraid to approach the person when he is having the fit. Now, the next step is avoid putting something in the mouth, because most people always think that they are going to swallow their tongue, or they are going to, I don't know. But the main thing is not to put anything in the mouth. Put the patient in a comfortable position, in a position where they can easily breathe, and then observe well what is going on, and then avoid any sources of danger. For example, many people during fits have incurred burns or maybe other traumas which are not necessarily related to the epilepsy. So if somebody is having a seizure by maybe a fireside, it's good to bring them away from the fire, or bring them away from the roadside, or from maybe water and the rest, and then keep them in a calm position, put them in a position where they can easily breathe, and then avoid maybe putting something in the mouth. Because during the fit, there is like secretion of fluids and the rest. So the airways are somehow blocked or somehow narrowed. Now, when you go and put something in the mouth, you further impair the flow of air into the systems of that person. So you are causing more harm than good.
Often we get stories of school children in a classroom falling into a trance, about 15 of them, and so on and so forth. How is this different from epilepsy attacks?
Epilepsy, is good to know that there are other forms which are not really epilepsy, because all loss of consciousness is not epilepsy, or everything that manifests as fits is not epilepsy. We have what is called hysteria, or some sort of psychological causes, which we call psychogenic fits, which at times has been incriminated as the cause of this trance that usually takes place in school. I don't think it is epilepsy, because epilepsy cannot just spread to a group of people in a classroom like that.
Okay. Mm-hmm. So what are the complications that come with epilepsy? So
there are various complications. We may have complications related to the brain itself that is having the fits, or complications resulting from the fits that the person has had, maybe trauma. For example, due to recurrent seizures or recurrent fits, the brain can get damaged completely, and the person may develop now behavioral abnormalities or mental retardation. That is, if the fits are not controlled, because each time there is a fit, there is some sort of disturbance in the functioning of the brain. So if you have repeated fits without taking medication to control those fits, you have repeated destruction of brain cells, and in the long run, the person may develop mental retardation.
Would that lead to madness?
Not necessarily madness, but some form of cognitive dysfunction or behavioral problems. Apart from complications related to the brain, we also have cases where during crisis or during fits, a patient may develop maybe asphyxia, may have inability to breathe, as we have said, or may have other problems with heart functioning and die. So we have what has been described as the sudden unexplained death in epilepsy patients, what they call SWR. That's is not really explain what happened, and the patient during the fit end up dying. Apart from that, we also have complications related to where the person was having the fit. For example, if I'm maybe by the fireside and I have a fit, I can have a burn. So we have patients who have had maybe burns on the face or on the arms, or patients who can drown in water if they happen to have the fits near water.
Who are those who are highly predisposed to epilepsy?
So we saw the causes of epilepsy. So those who are predisposed are those who will be exposed to those risk factors that we mentioned. We mentioned neurological or brain infections. So if you have had maybe meningitis and it is not well treated, you may be at risk of developing epilepsy. If you have had maybe a stroke and you now have a scar in your brain, that scar in the brain can predispose you to develop epilepsy. We also have brain injuries. For example, accidents on the highway and the rest. If you have a trauma to the brain, if you have a traumatic brain injury, you are at risk of developing epilepsy. It may not be at the spot, but in the long run, because of the trauma that you had on the brain, the scar that is on the brain can cause electrical dysfunctioning of the brain and lead to epilepsy. So, and we also have very common causes around birth, maybe before pregnancy, during pregnancy, or after birth, or maybe during birth. If measures are not well taken, the child can have certain traumas which can involve the brain, and the child will be predisposed to develop seizures after or epilepsy after that period. Or if you have early infections during the neonatal period, that is the immediate, the few days or few months after birth, if you have infections and those infections are not well treated, the child can develop malfunctioning of the brain, and that can later on lead to epilepsy. So those are those groups that are basically at risk of epilepsy. And it's also good to mention that there are other causes that are genetic. That is, it is not overt. It's only after maybe studies that they can incriminate that the cause is genetic. Maybe it is from mother to child or to grandchild. And then it's also good to say that there are a percentage of causes that are not known. The cause is not precisely known.
And why is that so?
Well, it's so because science evolves every day. It's not everything that in nature that can be explained. So with time, the causes...
Is this not where the element of witchcraft comes in? The people who are saying that it's witchcraft?
No, it's difficult to incriminate witchcraft, especially in our setting where we don't have all the appropriate technology to look for the cause. For example, the genetic causes may just be a small malformation in the brain, which our maybe CT scan cannot see, and we may need maybe more sophisticated technology to see what was the malformation that is causing the epilepsy. So when you go to the hospital and after all the tests they tell you we have not yet seen what is causing, you directly say witchcraft, but which is not the case. At times it is due to limited technology that we don't uncover what is the exact cause of the epilepsy. But epilepsy, as we know, is not witchcraft.
What are the particularities of treatment when it comes to epilepsy?
So that's a very important aspect. It's good to say in Africa, especially in our own countries of sub-Saharan Africa, most of the patients that are suffering from epilepsy do not have access to treatment. About 80% of those who suffer from epilepsy do not have access to treatment, either because of financial reasons, either because of inavailability of drugs, or maybe geographical inaccessibility to health centers and the rest, or at times just because of the misconception that people have concerning epilepsy. You see, if people think that epilepsy is due to witchcraft, they will not go to the hospital for treatment. They will obviously go for traditional medicine or for witch doctors to treat the witchcraft that they think is the cause of the epilepsy. So that will hinder them from going for appropriate treatment. And it is known that when well treated, 70% of the patients, they will live a normal life. They will have no seizures. They will have their seizures well controlled. They can go to school, they can walk normally, they can get married, and they can live a normal life like any other person. So the treatment depends on knowing what type of epilepsy exactly is occurring. But generally, there are some medications or anti-epileptic drugs that cover most of the forms of the epilepsy. So in most cases, when you cannot do precise tests to say this is the exact cause, there are medications that will cover most of the forms. So you just place the patient on treatment. They take the treatment regularly, and then it will prevent them from having fits.
How long is the treatment?
Very important question, because most of the time, patients who live with epilepsy think you take your treatment for 1 month and then it is over. When you've been diagnosed as suffering from epilepsy, it is going to be a long-term treatment. At this point, it's good that we distinguish exactly somebody who has a seizure or a fit once from somebody who has recurrent fits. Because if you have a fit just once, it is not epilepsy by definition. Remember, we said epilepsy is that condition where we have recurrent or repeated fits. So if you have recurrent and repeated fits, which are not provoked by fever or which are not provoked by maybe any condition on the spot, then by definition, you're suffering from epilepsy, and the treatment is going to be a long-term treatment. Now, when patients are treated, you can have variable response to the treatment. We have patients who, when they begin treatment, after a few months or after a few years, they may never have fits again, in which case those patients are pharmacosensitive. That is, their sensitivity to the drug is good, and their epilepsy is responsive to treatment. After about 2 years, if they are no longer having fits, we can start reducing the dose of the medication, and eventually they may go out of the treatment. And we also say that we have specific causes. So if we have identified maybe that this is the infection in the brain that had led to the scar that is causing the epilepsy, if maybe we can treat the neurocysticercosis and we control it, it is possible that after some time, our patient may not need medication again. Now, apart from those that are sensitive to medication, we have patients who are resistant. That is, despite 1 anti-epileptic drug, 2 anti-epileptic drugs, at times even 3 anti-epileptic drugs, it is not possible to totally control the seizures, but then the frequency of the fits diminishes. I take an example. Somebody who is having maybe 3 or 4 crises every week, if when you place them on medication, you try to control to maybe 1 crisis a month or 1 crisis every other month, at least there is some control in the fits. And you have to strike a balance between increasing medication or getting, and with the risks of more side effects, and striking a balance with the number of seizures. So for those patients, they may take treatment for the rest of their life because it may not be possible to control all the seizures. So the treatment of epilepsy, the duration, it varies depending on the patient.
Who is supposed or qualified to treat epilepsy?
The treatment of epilepsy, in fact, epilepsy is a public health problem. So it's not something that should be treated only by specific people. So there is a lot of tax shifting. we have to train everybody to be able to manage epilepsy. For example, in the big hospitals, it's possible that if you have access to appropriate care, if there is a neurologist or a neurosurgeon or any other specialist that works with the brain, they can appropriately cater for patients who are suffering from epilepsy. When we go to the other health centers where we don't have all these specialists, even the nurse or the community health worker can be trained to take care of patients who are suffering from epilepsy.
How expensive is treatment for epilepsy?
We previously talked of access to medication. So the treatments, they vary. There are many forms of medications. We have, like, for example, the common phenobarbital, which is very cheap. I think it's about less than 1,000 francs for a cat of 30 tablets. So if patients do not have access to the most common medications, phenobarbital in most cases can control seizures. But then there are more common or more resistant medications like Depakin or Tegretol. These other medications are more expensive. So as a public health concern, usually the government tries to make phenobarbital accessible to most of the population. And for those who cannot really get control by that, they can go for further testing, and if they can afford, they will have to buy more expensive medications.
There are certainly practices that, as specialists, you want to discourage when it comes to the treatment of epilepsy.
Okay, we talked about misconceptions about the cause of epilepsy. We talked about people thinking that it is witchcraft, or people thinking that it is a curse or some other maybe evil spirit that is responsible for the epilepsy. So we have said that is not true, and if you want to get treated, it's better you go to the hospital and have appropriate treatment. We want to discourage for people going for maybe scarifications, because when you go for scarifications...
What is that?
That is when they use the blade to cut the skin and apply medications. Mm-hmm. You expose yourself to the risk of having other infections that are transmitted by blood. And then at times people go for all sorts of things. I think recently we had a case where a soothsayer or a witch doctor had to bite somebody from the back so as to let that evil blood flow from their system, which is a very bad practice. That's for the treatment. Now, for managing the acute crisis, we mentioned the fact that at times they want to put something in the mouth to prevent the patient from swallowing their tongue. We have said that is not correct. We have said the best thing is to take the patient away from any source of danger, and then put them in a position where they can easily breathe. You should not be afraid, because the sputum that is coming from their mouth is not contagious. We also want to discourage some practices by mothers. When a child is having a fit, at times they think that taking the child maybe close to the toilet will stop the fit, which is very bad practice, because you are exposing the child to more danger.
There is equally this issue of stigma surrounding epilepsy. When we have communities, like we have communities in Lebialem, communities in the West region, communities in the Northwest and in the Central region, what attitude do people adopt towards these people who are suffering from epilepsy?
So the stigma is really an important topic in epilepsy, because we have stigma that is self-stigmatization. The person who is suffering from epilepsy already feels discriminated by the society, and then also the conceptions that people have towards epilepsy make them stigmatize those who have epilepsy. And this stigma crosses several aspects. From the time the child goes to school, there is stigmatization. When the child is in a classroom and has a fit, the other students tend to maybe move away from the child, or they tend to abandon the child alone. So there is a lot of stigmatization. And teachers or other students can play a big role at that point to educate the other students and then also encourage the child or take particular care in the education of that child. The other point of stigmatization comes to when it comes to jobs. When somebody is suffering from epilepsy, there are people who are reluctant to employ somebody who is suffering from epilepsy, maybe because of maybe social reasons or other reasons, which is not a good attitude. And it's good to say that apart from certain jobs like maybe pilots or maybe drivers of big vehicles which will carry many passengers, or maybe works that involve highly sophisticated machinery which can cause problems if they have a fit. Most jobs can be done by somebody who is suffering from epilepsy without any problem.
And who is following treatment?
And who is following treatment, of course. Of course.
You're listening to the program Health Update over CRTV Southwest in Buea. We've been talking about epilepsy. Our guest is Dr. Cyrille Nkouanlack, a neurologist at the Buea Regional Hospital. We're going to take a break, and when we come back, we shall start receiving your calls. Remember, the number is 233-322525. 233-322525. We'll have a break. Welcome back. You are listening to the program Health Update over CRTV Southwest in Buea. We're talking about epilepsy. Our guest, Dr. Cyrille Nkouanlack of the Buea Regional Hospital. Doctor, we're going to talk now about the important issue of prevention.
Yeah. Talking about prevention, it still goes back to the causes. And when we mentioned the causes, we identified infections as a very good, as being responsible for many cases of epilepsy. So if we want to prevent epilepsies, the very first thing is that we should eliminate those infections that cause infections at the level of the central nervous system. For example, we talked about neurocysticercosis, which is from pork meat, which is not well prepared. So if we want to prevent epilepsies that are caused by that form, we have to prevent people from eating pork which is not well prepared. We are not saying that people should not eat pork, but that they should prepare it well so that the larval forms should be destroyed before they eat the meat. Also, we talked about head injuries. So if we have to prevent epilepsies, we have to make sure that we prevent cases of head injuries. For example, bike drivers should put on their helmets so that if they have an accident, there should be no injury to the brain, and it will prevent them from developing epilepsy later on. Also, we talked about causes that are related to birth, like antenatal or perinatal causes. So if we have to control or prevent epilepsy, we have to prevent all those complications that can take place at birth, which can either lead to lack of oxygen or to trauma of the brain of this child which is developing at an early stage. So if we control and prevent all those complications, we are going to prevent a good number of cases of epilepsies that can occur later on. And then also we have to educate the population about how to avoid most of these tropical infections. Because if these infections are avoided, for example, by avoiding or preventing malaria, you are not only preventing malaria, you are also preventing severe cases that can lead to epilepsy. By appropriately treating maybe meningitis, you are preventing maybe cases of epilepsy that can occur later on in life. So generally, it's by controlling all those risk factors that or all those causes that we prevent cases of epilepsy. And then there is also one important chapter, people who are having strokes. In fact, many Cameroonians are having strokes nowadays, and those patients who have stroke, they have scars in the brain, which can later on lead to epilepsy. In a group of patients, it can lead to epilepsy. So when we prevent the cases of stroke, we also prevent epilepsies that can develop in patients who have had strokes.
How vital regular antenatal care good for the prevention of epilepsy?
I think having appropriate antenatal care will identify maybe those women that are at risk, or especially at birth, because most of the complications or most of the trauma or lack of oxygen to the brain, it takes place at birth. Because if the delivery is not well taken care of, there can be injury to the brain, or there can be neonatal asphyxia, which will lead to less flow of oxygen to the brain, and the brain of that child will develop complications that can later on lead to epilepsy. So if we appropriately train maybe those who are taking care of deliveries, midwives, and maybe other workers, other people who take care of patients who deliver women, will control cases of epilepsies that result from that.
You're listening to the program Health Update over CRTV Southwest in Buea. Our lines are now open. The number is 233-322525. 233-322525. If you call, we have a technician on duty who is going to connect you to the studio directly so that you post your worry or your question to our specialist in the studio this morning talking about epilepsy. It would appear we have somebody on the line. Yes, we have somebody on the line. Hello. Good morning. Good morning.
Doctor, like people say where people believe it is witchcraft, a doctor has come to dispel it. And really, alternative medicine, and we all know what I mean by alternative medicine, you should be honest to not to dive into area where they really don't know, but they claim they know. Doctors, you talked of head injuries are sportsmen, footballers who hit the ball a lot, particularly boxers. We always hear of Parkinson's disease, but if it is not Parkinson's disease for boxers and wrestlers, will it be epilepsy? Difficult delivery with protracted labor, can it cause a child to have epilepsy? And subsequently, even the mother who goes under labor, all the various labor problems that we know, like eclampsia and all that, can epilepsy, when it is not well managed, be a factor? Illicit drinking, all these drinking and drugs that have been banned, crack, cocaine, constant taking of them, will it ultimately cause epilepsy, doctor? Thank you very much for coming, doctor.
Thank you very much, good old Patrick. Doctor, over to you.
Thank you very much, Mr. Patrick. I think you actually summarized most of these causes, because for boxers and for wrestlers, they are at risk of brain injuries. And if they are at risk of brain injuries, it means that if they sustain a trauma to the brain, they are at risk of developing seizures and epilepsy. You also talked about difficult deliveries and protracted labor. This difficult delivery can lead to trauma to the brain of this child, or poor oxygen supply to the brain of the child, and the child can develop conditions in the brain that will later on lead to epilepsy. And I'm really happy because you brought about a point which I did not mention in the courses, which is about alcohol and drugs. Because alcoholics, they are at double risk, because when you are alcoholic, if you get drunk, you are at risk of brain injury. And then also alcohol itself can lead to changes in the electrical functioning of the brain and can predispose somebody to develop recurrent fits later on in life. Likewise for other drugs like cocaine and the other drugs that you mentioned. So thank you for your contribution, and I think it's a good point.
Are there still some misconceptions about epilepsy that you want people to completely wipe out from their minds on this program?
We talked about the fact that epilepsy is not contagious. We have talked about the fact that it is not caused by some spiritual possession, or it's not some punishment from some evil spirits, from ancestors and the rest. And then other misconceptions is like work. Somebody with epilepsy is able to do most of the jobs that we do. So we should not maybe discriminate or stigmatize somebody and prevent them from having access to work. And then another point is marriage. Because of epilepsy, some people may not be able to get married because of the stigmatization that is associated with epilepsy. Maybe the in-laws or other parties may not want to associate with somebody who is having epilepsy for fear that they can develop epilepsy. No, you cannot transmit epilepsy to your partner. So people with epilepsy, they can get married and have children normally, like you and I. They can have children. There is no problem. So that's one of the misconceptions that people should dispel about epilepsy.
How important is the role of the medical staff in the prevention of epilepsy?
I think the medical staff has a lot to play. And at this point, I think we would like to thank the regional delegate of health for the Southwest, Dr. Mbomenje, who initiated one program with an NGO. And through that NGO, we've been able to train people in the Lebialem locality. We've been able to train health care workers at the local level, in the community, to be able to diagnose and treat appropriately cases of epilepsy, and also prevent all these causes that we mentioned. At that point also, we have been able to train some few community workers because of distance. At times, patients may not be able to have access to the hospital. So we have trained some patients, some people in the community. Most of the times, patients who are suffering from epilepsy, we incapacitate them to be able to identify other people in the community who are suffering from epilepsy and bring them to the health center for medication, for treatment. And at the level of the hospital, any doctor, any nurse can take care, if they are well trained, to treat cases of epilepsy.
There's always this tendency of patients abandoning treatment. When it comes to epilepsy, why do they abandon treatment?
I think it's not only epilepsy. Any treatment that has to go for a long period of time, it brings about the problem of adherence to medication. And it's at this point that we have to encourage the patient, have regular visits, and then try to identify what are those reasons why the patient is abandoning treatment. Is it because of side effect? Is it because of the cost of the treatment? So it's first of all good to identify why the patient is abandoning treatment, and then try to see how we can take care. Maybe it is because of the misconception. Maybe after taking treatment for a few years, they are still having a few crises, and they think that, no, really this thing is witchcraft, they have to go for something else. In that case, we'll have to explain to the patient that there are forms that you may still have maybe 1 or 2 crises from time to time. But globally, you are living a better life than if you were having more frequent crises. So I think it's a matter of education to the patients, to the general public, because it's not only epilepsy. For conditions like hypertension, diabetes, HIV infection, where patients have to take treatment for a long period of time or for the rest of their life, there is always that problem of adherence.
The side effects very troubling?
Not really. The side effects, since they control seizures and they act at the level of the brain, we may have some side effects like maybe dizziness or some slow. The patient may be a bit slow. But usually we try to strike a balance to get maybe the dose of medication that will control seizures without much side effect.
When is it appropriate to begin treatment for epilepsy?
The sooner you diagnose epilepsy, the patient has to start treatment. And the earlier you diagnose, the better. Because we said the more seizures, the more disturbances, or the more trauma to the brain, the more injury to the brain and the higher the risks of complications.
Okay, another caller on the line. Hello.
I'm back again, doctor. Thank you very much, doctor. I may have, doctor, quite often, like treatment for TB, people abandon this treatment because when this alternative practice sets in, they quite often narrow it down and say that some family member don't do the thing. That man will not be quarrel that they resolve this. And you see, doctor, they abandon treatment and witch hunting starts. Revenge, and you see a problem only gets worse. That's quite often what happens. Doctor, is there a hereditary factor in epilepsy? Does it run in a family? Since you have narrowed it down in some areas where the EBC that does it run in a family? Also medication. People website drugs which are often expired or not of good quality now will not be treated and there will be complications. Will epilepsy be one of the factors that will set in with roadside treatment, roadside drugs, expired drugs that have not really been vetted and approved? Thank you very much, doctor.
Okay.
Thank you, good old Patrick. Doctor?
Thank you very much, Mr. Patrick. As you said, alternative treatment, I think alternative treatment or African traditional treatment has a lot to contribute, but at times it's good to know what is what and what are we treating. So if you want to talk specifically about TB, as you mentioned, TB is an infectious disease. There are anti-tuberculous medications that patients take for a brief period. It's not even like epilepsy that you have to take treatment maybe for the rest of your life. For TB, there is a treatment that can last for 6 months, and in some specific cases, you can go right up to 9 months. So if you educate the patient well, educate the public about what is actually going on, I think there will be less risks of the patient abandoning their medication to go for alternative medicine. And then at times, alternative medicine can come to complement the treatment. So what I usually tell my patients is do what you want to do, but don't abandon this medicine. If you want to go for supplements, provided it is not disturbing this medication that you are taking for maybe your TB or for your epilepsy or for your HIV, do everything, but don't abandon the major treatment. And then you mentioned about hereditary factor. Of course, we said there are some causes that are genetic. So those causes that are genetic can be transmitted from parents to children or from generation to generation. So, but those are actually a limited number of cases of epilepsy. So we can have a case where brothers and sisters or from parent to children we are having cases of epilepsy. So it is possible to have those hereditary cases. Now you mentioned the point of roadside medications, which is actually a major public health problem. I think it is possible. It is possible that if you take medications which are maybe expired or not good, if they cause maybe metabolic injury to the brain, you can develop seizures. So it's possible.
How is the diagnosis of epilepsy done?
Okay, thank you, Mr. Teke, for that very important question. We describe that it is mainly recurrent fits. So the diagnosis for epilepsy will mainly be clinical. That's clinically if somebody has had fits once, twice, thrice, without any specific cause that is provoking the fits. By definition, it is epilepsy. Now, at times we may have to go into specificities. We may have to know what is exactly the type of epilepsy, because a fit can begin maybe partially and then get generalized. So in that case is when you do maybe further testing that you'll be able to say this is the specific form of epilepsy that you have. Or if the brain is having severe injury, which is responsible for the epilepsy, is by doing further testing that you'll be able to know what exactly is going on in the brain. And for the testing, we have tests which will measure the electrical functioning of the brain. And then we also have tests that will image the brain to look at the picture of the brain to see if there are maybe spots that are not well, which may be causing.
So at what level do we have a lab testing or scanning coming into play?
Scanning comes at the level of imaging. Scanning will image the brain, give you a picture of the brain and tell you this is the structure, and then maybe this is what is not normal that can be responsible for the fits.
We're going to come back to you, Doctor. Let's clear off the call on the line. Hello.
Hello, good morning, sir.
Good morning, sir. Whom are we talking to and where are you calling from?
It's Fontem from Buea.
Okay.
Doctor, please, I have a question. I have a patient who is taking phenobarbital. He was about to take Pregaton. They haven't taken Pregaton, they took the food current. And also, they have fever after having it. We are to find out.
Hello, Tom. Hello. Hello.
Yes, hello.
Can you speak out? We're not getting you at all.
Yeah, I'm saying I have a friend who has epilepsy. He has been taking phenobarbital. He was about to take the dispels. But after taking the dispels, the feet are so current. He has current feet. I don't know what medicine can he take.
Okay.
Hello?
Okay.
Is that all about your question?
And also, after the also I wish to find out. Yeah, is it genetic? He had this one from age of 51. Once he had it sick, and since then they have been taking for 10 years now. But the sick is still occurring. I don't know, doctor, if you can help me to tell advice him on what he should do.
Okay. Thanks very much, Mr. Som. Doctor, what do you?
Thank you, Mr. Som. I think in the treatment of epilepsy, when we have said clinically there is epilepsy, at times we have to go further to characterize what type of epilepsy is the patient suffering from. And that brings us to studies that will measure the electrical functioning of the brain. That's what we call the EEG or electroencephalography. Now, if it is maybe a generalized form of epilepsy, there are a group of medications that will control better those type of seizures. If it is a focal epilepsy, there are medications that will better control this type of seizures. And then now when you are taking a medication, maybe you started a medication when you were maybe 60 kilograms. In the long run, you may be 70 kilograms or 80 kilograms. It is obvious that if you are not going for regular checkup, for the dose of your medication to be adapted to your weight and to other factors, you may have lost control of the seizures. So it is not only the type of epilepsy, but it is also the dose of the medication that you are taking. You may start taking Tegretol maybe at 200 milligrams a day, but in the long run, you may need about 400 or 800 milligrams to actually control your seizures.
He has a last question that we'll have to provide an answer to. But before we do that, let's have this other call on the line. Hello.
Good day, back again, doctor. Simple one. What level of sport, depending on the level of epilepsy, what level of sport the epilepsy patient or can do? Can they do a mountain race, marathon? What level of sport, doctor? Thank you very much.
Okay, I think it's a nice question. Patients who are suffering from epilepsy, they can participate in most sporting activities or recreational activities if their seizures are under control. So if the seizure is under control, you are not having fits, you can participate in any sporting activity.
There was a question. Yes.
Except those that involve maybe heights. So if it is mountain race, as you climb further in the mountain, the partial pressure of oxygen is getting lesser, you are at risk of having a seizure. So for mountain race, it may not be very appropriate. And then also sporting activities that may take place in water like swimming, you may need to take some specific conditions of safety before you allow a patient to go for such sporting activities.
There was a question he asked before concerning boxers and footballers who are heading balls and head bouting other footballers on the field. Are they exposed to epilepsy?
I think we answered by saying if the boxing becomes excessive and there is traumatic brain injury, there is a risk. Remember, we are talking of risks.
Should the umpire stop when it becomes so excessive, when one of the boxers is like raining blows upon blows in the head?
No, the fact that there is a risk does not mean that it is going to directly cause epilepsy. It is a risk and not a direct cause of epilepsy. Yes. You are at risk of having a brain injury, which can lead to epilepsy, but it is not a direct cause of epilepsy. Yes.
The last question of some, I can't remember, but I know you took note of the last question of Mr. Song.
He was talking about age.
Okay. Age in terms of hereditary factor, that this is a situation of somebody who started having epilepsy attacks at 21 years.
Yes.
What could be the cause? Is it still linked to infections?
Okay, now you see the causes also vary with age. We talked about perinatal or antenatal causes. For those children, the seizures will begin very early in life. Maybe by the age of 5 or by the age of 8, they will start having seizures or fits. But if you have fits that begin maybe from adolescence to maybe 21, you start thinking of some of those genetic forms. Now, if it is in adults, for example, an adult patient who start having fits, you have to think of trauma. Maybe they have had trauma to the brain. You have to think of tumors. Brain tumors can also manifest as epileptic crisis. So if an adult of maybe 60 comes with recurrent fits, I want to know if there is no tumor in the brain. So I will need to do imaging to exclude the cause. So the further you go with age and the onset of the fits starts later in age, you have to look for a secondary cause. Take
home message very briefly on this program as we conclude.
So as we conclude, we want to say epilepsy is not is a neurological disease. It is not something that is due to witchcraft or which is due to evil spirits. We want to say that epilepsy has treatment. It can be treated, and when treated, more than 70% of the patients, they can live a normal life.
Okay, thanks very much, Dr. Cyrille Nkouanlack, neurologist at the Buea Regional Hospital. It was a pleasure receiving you on the program this morning.
Thank you, Mr. Teke, and thank you to all auditors and the
callers. Sophie Joseph Maliba was on the panel mixer. Lydia Ndolo was on the books. Many thanks to our friends of Radio Bonakanda who relate this program. I've been your host, Tikijilo, saying thanks for listening and have a great weekend. Bye-bye.